Keeping a neutral spine when you think about back pain is very easily done in the individual, because we have to assume that all individuals are going to have a normal spinal anatomy, because that's what normal is, right? Although you do find over the years, or seeing lots of people with back pain, that more commonly those with long-standing low back pain and sciatica have a flattening of the lumbar curve, but I won't get into that for this particular chat. The easiest way for you to maintain neutral is to go and stand against the wall. Put your heels, your bum, your middle back and your head against the wall. That is your neutral. All too often, people then try and tuck their pelvis one way or the other. Forget about that. Just stand against the wall like I just mentioned, and that will be the best guide that you can have for neutral. Now, a great tip to help you understand this and when neutral is being lost and you're moving into flexion is if you take a step away from the wall and then you get someone to stick some tape. We call this a tape test. I think we've got a video coming out on this soon. We have a video on how to use it for squats, but we've got another video coming out on this specifically for daily activities. And then you get someone to stick with you remaining in that stood tall position, maybe lift your top up a little bit, get someone to stick some tape about 3 to 4 inches long on the lumbar spine. Okay, you find the two bony bits of the dimples at the base of the spine come in, up about 1 centimetre, and then stick it from there up. And then do something around the house, like go and pick something up off the floor, or move a chair, or lean into the sink, or wash your teeth, or whatever it is, right? Wash your face, and you will feel the tape pull on your back, and that's when you're losing a neutral spine. And that's pretty much it. Keeping that spinal posture in the lumbar spine as a neutral when you're doing stuff is maintaining that neutral spine, and that requires a degree of control. And what controls it is conscious, is that coordination, but it's also the muscles of the corset, and how the abdominal muscles, transverse abdominis, the obliques, etc., the lumbar spine, and the other muscles maintain that neutral spine when it gets strained. For example, if you go down into a squatting position, hip immobility, stiffness in the hamstrings will start to pull on your pelvis. That will mean your pelvis starts to rock and you'd feel that tape start to pull, which means you're not maintaining a neutral spine. But the easiest way to get it into it is, again, do that wall test, then stick some tape on your back, and then at least you know when you're coming out of that neutral spine. And the neutral spine is just a natural lumbar lordosis, the backward bending curve that we should all have in our lumbar spine. And that's what we need to preserve and control, because it's loss of control of that actually perpetuates these lower back issues, especially when we're talking about disc injuries and other such issues in the lower back.